The positive psychology itself, it's quite easy to understand, in my opinion. However, it's not the understanding that actually makes a difference. It's about applying or application of these positive psychology tools.
Hello and welcome to the Medical Protection Podcast Headliner Series. I'm your host, Dr Lynne McKinlay. In this podcast, I'll be talking with Dr Albert Chan. Albert is a consultant anaesthetist in the Department of Anaesthesia and Intensive Care at the Prince of Wales Hospital in Hong Kong and Honorary Clinical Associate Professor at the Chinese University of Hong Kong. In this podcast, we're going to be speaking about some interesting research that Albert is doing, looking into how to prevent or reverse burnout. Anaesthetists have been identified in the literature as a specialty with high risk of burnout, mental illness and physician suicide. And there are some very particular stressors faced by anaesthetists. Albert, you're about to embark on some research to look at what measures are effective to counteract burnout within the specialty of anaesthesia. What's motivated you to undertake this research?
Thank you for having me, Lynn. I want to begin by talking about what motivated me to do this kind of research. So I have a personal interest in education, both locally for our Hong Kong College for Anaesthesiologists and the Academy of Medicine. And that put me into the realm of understanding how well-being is very important for postgraduate medical education, as well as fellows in our college. So this dates back to 2017, when I had a personal experience with a colleague close to mine in the department who unfortunately tried to take their own life. Fortunately, they survived, but that made me realize that these stressors are not only reported in the news, it can actually happen to someone quite close to us.
Yeah.
That had a huge impact on me. And because even during that time, personally, I felt the stressors becoming to accumulate through clinical work, through personal lives, and this manifests itself in different ways. The thing that actually was a tipping point for me was in the end of last year, 2021. A colleague in another hospital, not my own hospital, actually took their own life. So that was a wake-up call for all of us. And we tried to set up officially mechanisms how we can address these issues. Be it at the college level or the departmental level, because this is a huge area that has a lot of impact on us, I think.
Yeah, that's incredibly sad and a real, as you say, a real wake-up call that there's something we need to do differently, right?
Yeah, certainly. So we moved in the direction of trying to find out ways that we can help not only ourselves, but our colleagues on how to improve their well-being in the workplace. The problem that we had encountered with that, we don't know what works. For one, because there's so many different interventions out there. And second of all, the reality of the fact is that we are busy clinicians. So having the time to go through these, first of all, bring about the awareness and also implementing these measures, I think is challenging, yet is important for us to understand.
I think it's really critical, isn't it, to work out what works. And you're right, there's a lot of research in this, but it's hard to know what will work for busy clinicians who don't have a lot of time to spend, right?
Yes, exactly.
So what do you think, your own reading and your research in the literature before you actually decided to apply for some funding to do this research, what did you think was going to help doctors to cope with these stresses of professional life?
Well, I think the premise of everything we're doing is not only because of its impact on our own professional lives, it also has an impact on patient safety. The research that I've come about clearly shows that when physicians aren't taking care of themselves, it impacts their clinical decision making, impacts on how they build relationships with patients, with each other, and ultimately patients may suffer from the consequences of this. So with that in mind, and also a recent study in our own locality showed that up to 73% of young doctors are experiencing burnout. So we have to put a plug on this and help us move forward. Um, and which is why this research has propelled me to move in this direction.
So, Albert, can I just check, was that 73% of doctors in Hong Kong, young doctors?
Well, young doctors in this survey. So we can.
Wow.
Yeah. So it's quite a big number, I think. And I think the COVID pandemic has just exacerbated this and made this even worse. Well, and the reason I picked our specialty, obviously because I'm working in it, but as you mentioned, anesthesiologists or anesthetists, depending where you are, have been known in the literature for high burnout rates compared to other specialties and also suicide rates. So I think this is probably an area that, a profession that will have high yield if we can implement successful measures in this regard.
I understand you're just starting out on this research. Can you tell us a little bit about, tell your listeners a little bit about what methods you think will likely to yield the results that you're looking for?
During my literature review, I found out there have been reported multiple, numerous ways where people try to combat physician burnout, be it, group therapy, mindfulness exercises, gratitude giving. But the challenge, I think, is that, what actually works and how we can make it happen. One particular aspect that I found was interesting was the idea of positive psychology and how it may help combat physician burnouts. So for those of you who don't know what positive psychology is, it is actually a scientific study of character strengths, positive relationships, and life purpose that enable individuals and communities to thrive and live meaningful lives. So I think it was an idea that was made popular by Martin Seligman, and it consists of 6 aspects. It's called PERMA, PERMAH, with each letter signifying a different aspect. So P stands for positive emotions, E stands for engagement, R stands for relationships, M stands for meaning, A stands for accomplishment, and H at the end stands for health. And there's a combination of these kind of positive attributes that help one thrive. There has been plenty of studies of positive psychology in non-clinical or non-physician population and shows the efficacy in reducing burnout and enhancing resilience. And on and off, there has been also some studies, although not randomized controlled or anecdotal studies, reports that of its efficacy in physicians. But I find that perhaps this is something that is worthwhile to look into amongst our population.
I think that sounds really interesting, Albert. Certainly from my reading, I know that there is some good evidence for the effectiveness of mindfulness. But as you've said, that hasn't necessarily been figured out how to do that for our physician population, because doctors may not have the time to do the training or to practice, etc. I believe you might be looking at some technological solutions to help make this, I guess, more achievable by doctors.
Yes, you're exactly right. The most common thing I hear when I talk to, my fellow colleagues is, I don't have time for this. I don't have time for this. But, in my mind, I think these are being able to work better when you address your, positive psychology issues, when you are more, mentally equipped to handle the stresses of work, then you will be able to manage your daily living, your time better. That's just my own personal philosophy. So you're right. So I think what I'm trying to look into is how, web-based applications can help us move in this direction. And in the field of clinical psychology, there has actually been implementation of such web-based applications. For example, in self-compassion training, mindfulness training, and cognitive behavioral psychoeducation, and has been shown to be effective. So, which made me kind of a light bulb bulbs up that, physicians are equally or not even more busy than, the normal population. And there has to be a way for us to be able to access these interventions per se, I would say interventions at a more easier level. On one hand, I understand that physicians, well, at least in our culture, are worried about stigmatization. So having web-based applications which is rather anonymous may help them be more aware of what their limitations are, how these things are important in their lives, and also apply some of the tools that we have proposed for them. That's for one. And the second thing is that the accessibility makes it more easy than having, perhaps 1-day workshops, 2-day workshops, a sequence of workshops, which has been shown to be effective, but also quite time consuming. So hopefully using an integration of these methods, we can try to help doctors not only be aware, but also to apply these interventions in their daily lives.
So it sounds like what you're suggesting is that if you had something on your phone that you could use to practice your positive psychology intervention, that would be both convenient but also discreet in terms of people not feeling that they were doing something, outside the realms of what they would normally do, or, allow them to sort of have it just in time, as it were, as well, because it'll be right there in your hand, I guess.
Yeah, exactly. And so the way we're thinking that what we're going to do, actually just plan for the research is, if I may speak a little bit to it.
Yeah, we'd love to hear a little bit about it. Great.
The thing about, positive psychology interventions is that the positive psychology itself, it's quite easy to understand, in my opinion. So, being engaged in your work, having meaningful relationships, and making meaning of what you do will actually help you, have a better well-being and resilience. However, it's not the understanding that actually makes a difference. It's about applying or application of these positive psychology tools. So the idea is that through an app-based or web-based platform, those who are undergoing our program will get these prompts. Daily prompts are simple prompts. For example, Lynn, would you like to give thanks to one person at your workplace today? So simple interventions like that, and ask them to reflect upon that, I think is the aim of what we're going to do.
That's a great one, because certainly gratitude is one of those positive psychology interventions that's got a pretty good evidence base, isn't it?
Exactly.
But we don't always think about it.
Yeah, so that's one thing. So it's a series of interventions. Of course, gratitude is just one of them. It's also about, thinking about the meaning of what you work on. And I think the most important part out of all this is the reflection that that the participants can bring about on their lives and how to further improve. And by saying that, we hopefully, through our intervention, can also build a community of practice, where we all share a common language in these positive psychology or well-being measures, such that we can all help each other in the future as we move along and trying to improve our well-being.
That sounds like a really powerful intervention that you've designed there. And I really like this idea of a community of practice and sharing a common language. I'm aware, Albert, that you've got a lot of experience and expertise in simulation training. Do you think there are some similarities between what you're trying to do here? Because, this in sim, you often have to kind of get everybody on the same page and they have briefing and the debriefing, etc. So is there something you think there's any similarities there?
Oh, Lynn, I actually haven't thought of this before, but that's a very interesting question. And I think there are some similarities. I think one thing that is very important in simulation-based education is the idea of psychological safety. Mm-hmm. So I think without being psychologically safe, it's not easy for us to share what we're thinking, to acknowledge our own limitations or difficulties that we're facing. So I think having this kind of community, having this platform for everyone to feel psychologically safe and share their own feelings and reflections is important. And also what you mentioned about the idea of debriefing. So having the experience of these positive psychology interventions is important, but we also have to have a way for them to share what they've learned through community sharing, through debriefing, through talking with each other on an online platform, if they're willing to. Of course, it's not forced upon them, that they can further, if they have some abstract concepts in mind, they can actually reflect upon that and put that into practice. I think that's a great analogy. And thanks for helping me make that connection.
Well, yeah. I think one of the things that I have seen in my own workplace and amongst my colleagues is that, even if we did have the time to undertake self-care activities, whatever they were, whether that was mindfulness practice or gratitude or the other positive psychology, or even things like having a meal break and having breaks from work, etc. Even if we have the time to do those things, sometimes there are cultural barriers to overcome. And when I'm talking about culture, I'm talking about the culture of our workplace and the fact that we have to be all, busy all the time and, working really hard and working harder than everyone else, etc. I think a lot of our colleagues in medicine find it really difficult to put their own needs first and to invest in their own well-being. I think you've already kind of pointed out that using an app which is discreet and convenient and can remind you to do stuff will be one step. Do you think there are other things that need to change in order for doctors to actually prioritize their own well-being?
Well, Lynn, I think there are definitely a lot of other things that need to be changed. A lot of this has to be in the organizational level, I think. What we're trying to implement here, of course, is individual awareness level, which is also very important. But also the organization has to be aware of what the problems are, what the challenges that doctors are facing, and be able to have measures in place that can facilitate them to have this kind of reflection, and also help them build, kind of a level of support for them when they're dealt with a tough hand, if I may say. So hopefully what we're doing here is that having these kind of exercises that, participants or doctors can apply to the workplace. We're not only targeting, junior doctors, but also senior doctors, such that we can make an organizational culture change that, okay, these are the things that we can do to help each other, to build support for each other. And ultimately, when it becomes pervasive, then the culture change will only help doctors improve the whole well-being as a whole within the whole organization, not just individual doctors.
I think it's probably true to say that if the senior doctors don't do it or don't support it, then the junior doctors are not going to, are they? That they won't necessarily swim against the tide in that way, I don't think.
Yeah. Well, not to blame senior doctors per se, but they probably never had the awareness of this in the past, which is actually interesting because in our college, we actually recently ran a workshop at one of our annual scientific meetings, and there were both senior and junior doctors within the cohort of the workshop. And actually the senior doctors, when we talked about positive psychology, wow, we didn't realize that, throughout our training, throughout our practice, we have been experiencing these kind of stressors at work. And certainly maybe some of these, interventions may actually help. So it was a, heartwarming to see that even senior doctors feel that, maybe this is something that is important, but just hasn't been addressed.
And I think what I know, and I'm sure you do as well, of our colleagues, is that we want to be persuaded by evidence. We want to be persuaded by science. We don't want to just read something that sounds, like warm and fuzzy. We want the hard facts, right? So I think your research is really going to contribute to that evidence.
Exactly, and that's my hope, that we can actually show something that works for our physician population. So
your research is focused or targeted to anaesthetists. Do you think your results will be able to be translated to other specialties?
Well, I definitely hope so, and that's also the aim. Well,
there are some special stresses that anaesthetists face, though, aren't they? Catastrophic things that can happen under.
Yeah. So, Lynn, absolutely right about, some of the stressors that anesthetists or anesthesiologists experience on a day-to-day basis, especially in a tertiary hospital where I work at. We often have to manage high-risk surgical patients who are frail, complex surgeries, and we have to be, as the nature of us, to be constantly vigilant to avoid things happening. But when actually things happen, we have this negativity bias and think that, oh, I wish I could have done this better. And we tend to dwell on past mistakes as such. So actually a study actually showed that more than 80% of anesthesiologists have at least one, kind of critical catastrophic event happening under their care.
Wow.
And this seems to have a huge impact on, clinicians, even if they decide to stay on because of the stresses they have to experience. So, this is something that is unique to a specialty. But again, back to your question, I think and hope that, or even evidenced by the local survey that up to 73% of young doctors in Hong Kong may experience burnout. And this is across specialties. So this is not just about us. And so burnout obviously is an issue that is not limited to anesthesiologists or anesthetists. So one thing that hopefully these interventions will also apply to other specialties. I know that surgeons at my institution are also burnt out. They work quite hard. They have long working hours as well. And, if we have an intervention that is easily accessible, as I mentioned, and help change or build a culture of recognizing these issues, I believe it will also apply to other specialties as well.
Well, I hope so as well. One of the things you just said, and I'm just going to check if I heard correctly, because it was a bit of a light bulb moment for me as well. You said that anaesthetists, by the nature of the work you do, have to be hypervigilant, have a bias towards looking for things that are wrong, looking for the negatives, and also tend to be fairly self-critical. Was that what you said? Did I hear you correctly?
Yes, exactly.
The hypervigilance is interesting. You said that anaesthetists need to be hypervigilant. That's part of being an effective anaesthetist, watching, looking out for things that are going wrong. I wonder if that hypervigilance itself has an impact on burnout.
Well, I believe so, partly because, we don't really put ourselves at rest, throughout the work. You may think that, anesthesiologists or anesthetists sit in the operating theater just looking at a monitor or spacing out. But the majority of us, if I may say, not all of us, are constantly thinking about this change in the vital sign. What does it mean? What are the surgeons doing? Is there anything that's going wrong with the patients? Or is there something that may go wrong with the patient if we don't do something immediately about it? So, constantly we're bombarded with stress. And when something happens, it just surges our adrenaline even more. So, this is my perspective. I might be biased because I'm in the profession, but
no, I think it's an interesting thought that kind of constant, I guess, alertness and having the adrenaline switched on might be something that's important. In your research, so you mentioned before that it's a common experience of anaesthetists to experience or to be confronted with a catastrophic event. Is there any part of your research that actually kind of tracks, what to do after such an event, or how to help people kind of respond to those acute stressors?
Yeah. So we're in our research, in our intervention group, we are going to have 5 modules. So each module will target at specific aspects of well-being as well as implementing positive psychology measures. So the first one where we targeted is how to establish rapport and conflict management in the workplace, which seems to be a common theme, not only for anesthesiologists. We work with multidisciplinary teams inside the operating theater, nurses, doctors, allied health staff. So this is an important, and seniors and juniors, and there may be potentially conflict in the workplace. Second is how we can find meaning and accomplishment in the workplace. Obviously, despite our busy workload, hopefully these are the things that can keep us motivated, drive us, and we have some specific tools for that. The third one is exactly what we're talking about here, is how to thrive in the face of adversity or adverse clinical events. Is these things, it will inevitably happen. How can we use positive psychology to kind of navigate through these difficult and challenging times? Fourth of all is how to maintain engagement and positivity at the workplace. And finally is how to sustain these practices through awareness, mindfulness, gratitude, things that we can keep this, positive psychology throughout our workplace, even beyond the 10-week module that we have.
Wow. Obviously, you've done a lot of research yourself, a lot of reading. You've come up with this model of the 5 parts of this you're going to focus on. One of the things that our listeners often like is if there is some, I guess, simple tip or some personal recommendation that you might be able to make. I'm wondering, in all of the reading you've done, etc., have you tried a few things yourself? And is there something you think that's a bit of a high value kind of thing that you're recommending to your colleagues that you might recommend to our listeners?
So I don't think there's one specific thing that works for me. I think that's just kind of about positive psychology. It's not just one thing. One thing may mean more for one person, and one thing may mean more for another person. I mean, one aspect of the PERMA or positive psychology. For me, I think few things actually help me the most. One is the reflective piece. So able to reflect on, what, and appreciate what you have. A lot of people focus on the things that they don't have. The other person gets off work on time earlier than me, etc., etc. But not so often we focus on the things we actually have and appreciate them, like our colleagues, the meaningfulness of our work, the patients we're saving, we're helping. I think that's one thing that helped me. The second thing that really helps me is try to foster and maintain meaningful relationships. It has been particularly hard in COVID, honestly, because we lack social meetings. We don't have these gatherings with our colleagues or, friends anymore. But at the workplace, having these kind of meaningful relationships, it could be just a mentoring, relationship, or a peer support relationship. But having and cherishing these relationships, giving a helping hand when they need, when they're faced with a crisis or critical situation, go give them a hand. That actually helps me personally to feel better, not only about myself, but about how things are going. I think the last thing that's very important that we really don't do enough is, at least in our culture, is show gratitude. It's not just like simple thank you for doing, but be specific. Thank you for doing what? Thank you for helping me save the patient. I think having these kind of tools has actually helped me personally. And of course, finally, is maintaining your health. I personally love sports, swimming. I've recently taken up wake surfing, and engaging in these activities, be it how busy, spend one day a week or a half an hour in the morning to do some exercise actually has helped me a lot.
That's really helpful to hear about your own personal insights from what you've taken away from the literature and what you're actually trying, reflection and relationships and gratitude. And it's true. I think what you said about when I help someone else, that actually makes me feel good. That actually gives me a well-being boost, doesn't it? And then looking after our health, and particularly, how moving our bodies, how that can help to restore our well-being. It sounds like a fascinating project that you're undertaking. I really like the fact that you're bringing quite a bit of specificity to it to actually help your population of peers, which is the anaesthetists, with the very specific and difficult challenges that are faced by anaesthetists very commonly. But hopefully, as you say, those learnings will also apply to other specialties and can share that with your other medical colleagues in Hong Kong and indeed around the world. I think it's been really wonderful to hear about this research, and actually hopefully we might be able to come back in a little while next year or whenever the research is done and hear how hear what you've achieved and maybe learn some more about what's going to actually help. Because for sure, burnout is a huge problem being faced around the world. And I think everything has been exacerbated by the pandemic, including those impacts on our well-being. So look, thank you so much for your time this evening to share with us your research and your personal insights.
Thank you for having me. And I think having this opportunity to promulgate the importance of our well-being and avoiding burnouts or combating burnout is a great opportunity.
And with that, we reach the end of today's podcast. And we've heard about how positive psychology and technology might be used together to improve wellbeing for anaesthetists and for other specialists. If you're a member of Medical Protection Society and want to learn more, please take a look in the podcast description for further information and an opportunity to join us for our next virtual workshop on beating burnout. If you're new to podcasts, maybe listening for the first time, make sure you subscribe to the channel to make listening in the future easier. You can access this podcast from all the major apps, including Apple and Google Podcasts and Spotify. For more information about medical protection, or if you're already a member and would like a certificate for listening today, please look for details in the description. I've been your host, Lynne McKinlay.